Hello, everyone. My name is Dan Toner. I'm the new health insurance broker for Nityo Infotech. I'm sharing my screen with you so you can see some handouts and let you know what we're doing. We're conducting an open enrollment. We're going to be changing the medical insurance from Oxford United Healthcare to Aetna starting September 1. Before we get started, in the memo, you'll be getting this through email. My contact information is on page 14 with contacts and resources. This is how you can reach Aetna. I'll talk about United because we're maintaining the dental and vision, but my company, FFP, this is me, and you'll be dealing with also Amanda and Leslie, my support team. So my company, FFP, has been asked to take over the health plans, and we're going to help conduct open enrollment. We're going to conduct open enrollment from Wednesday, the 7th of August till Monday, the 19th. That gives everyone roughly a little shy of 2 weeks to log in. It's important that we wrap up on the 19th because we have to get information to Aetna and start the new plan. And we're going to transition smoothly from Oxford Medical to Aetna. And I'm going to go over in a couple of minutes kind of why we're doing that. So as I'm going to go through this memo kind of quick, in order to be eligible, you have to work 30 or more hours a week. There's for new hires during the year, there's a 1 month waiting period, and then you're eligible. We are introducing 3 different medical plans. The dental and vision we are keeping. Those renewed back in May. I'm probably going to ask United to make those renewals next year in September so it matches and we don't have 2 different open enrollments. If you need help getting on the dental and vision, contact me personally because it's not open enrollment. Those products renewed back in May. Open enrollment was April. But if you need help with dental and vision prior to next year, let me know and we can come up with a plan. A couple of things about why we're going to Aetna. Similar to Oxford, all the plans are nationwide, 100% coverage for your well visit. Here, all the plans have in and out of network. You don't need a referral to see doctors. We have 3 out of the 2 plans, 2 are very, low cost, one being HSA compatible, and then we have a pretty rich option. So we're kind of giving a range for people. I'm going to blow this up a little bit, but okay. I'm going to start with the middle plan, which is very similar to your plan that you offer as the base plan right now. You'll notice from a premium standpoint, these are the monthly costs that are at the bottom. And this is important. This number is based on the people that we're enrolling today. The more people enroll in general, these numbers may come down. So this is a projection based on who's enrolled today. Again, that could come down with more people. The option 2 is an HSA plan. HSAs are important in the sense that you have a high deductible. There's no copay to the doctor or pharmacy. You owe 100% for every claim except for well visits in the form of a high deductible, $6,500 if you're a single and $13,000 if you're a family. Because that plan is set up and this is HSA compatible, that means you can open up a private bank account called the health savings account with a bank and put away HSA contributions pre-tax. You have to be enrolled under an HSA compatible plan to have that bank account. We wanted to maintain this plan and keep an HSA for those that were looking to not only save money in premium, but to put money away. This plan 1 is a little interesting because it's not HSA compatible, so it wouldn't have that bank account, but it's even less premium, and that's why we were attracted to Aetna. This is perfect for people that really just want doctor copays and pharmacy copays, but they're okay with a high deductible for catastrophic stuff, hospital surgeries, MRIs. So I'm going to go over this plan because it's very unique. And you can see by premium, we think a lot of people are going to consider this plan. Number 1, you pay nothing to go to your primary care ever. Your well visits are free on all plans. But with this plan, if you go to an Aetna nationwide primary care doctor during the year for a sick visit, you never pay. Number two, if you go to an urgent care center, that's not the emergency room. Those are the med-emerges, the city MDs. Those are those urgent care centers. You never pay. Those are free. And number three, generic drugs are free. So you have well visits, primary care, urgent care, and generic drugs for free. That makes this plan super unique, and it's a lot less in premium than the traditional plans. What does this $81.50 deductible mean for all other claims, like a specialist copay, hospital, surgery, emergency room, name brand drugs, all of the other services? You pay if the doctor bills this, Aetna gets a discount. You pay the discounted Aetna rate all the way up to $81.50 and then nothing else after. So your worst case scenario is still $81.50 no matter what happens to you. All the hospitals, surgeries, MRIs, name brand drugs, you'll never pay more than $81.50 for the year. But there's a host of visits that are free that we liked. So again, this is a unique plan, one that's very popular, and I think a better option as the low-cost base plan. So that's why we're introducing this plan as number one. Number two is HSA compatible, as I just mentioned. And three is we want to give the ability for a really rich plan. So this point of service 2,500 works as follows. You'll have a copay to your primary, a copay to your specialist. You'll have a copay for not just generic, but name brand drugs, 45 for generic, for preferred name and 75 for non-preferred. That's the most you pay at the pharmacy for a 1 month supply. Then when you have things like hospitals and surgeries and MRIs, there's a $2,500 deductible, and then you owe nothing. So that's a much different plan, and you could tell the premium is higher because of that. So this is a third plan for those that anticipate a lot of bills. So again, that's those are the three different plans. Even though, and by the way, I've given you a description right on page 4, just everything I said, so take a peek at that. The memo is comprehensive for the whole year. I'm just describing the dental plan that you have today that renewed in May and the vision plan that you had that renewed. This is how you look up doctors for Aetna. So I've given you instructions on page 11 of this memo. We're using the Aetna Point of Service 2 network. This is how you find your doctor. And by the way, it's nationwide, so it's in all states. This is the MyUHC website to basically find your dentist and vision provider. How to enroll. You're getting an email to register under my benefit link. It's my company's software that we use. It's a site that we use and paid for you. This is an open enrollment portal, open 24/7. When you go in, you'll see a few different steps to register, add dependents, and then you'll hit to step 4, which is the selection. Click select for your medical, and you will see the 3 different options. In the select button, you will see the cost to participate, and also you'll be allowed to waive. Make sure you do that and hit next and go all the way through to sign. This is the contacts that I mentioned. And then I've given you a bunch of information from pages 15 to 21. I do want you to take a look at this. Since we are changing over mid-year, Aetna gives you deductible credit. If you've met any deductible from January until August, this is how you submit it to Aetna to get credit. These are health and wellness programs that they give you. You can go to Minute Clinic. They're owned by CVS, so there's a big, powerful connection to go to CVS with a lot of programs, telemedicine, discounts at CVS. There's actually a rewards program to pay you $25 every 3 months if you go into CVS. So you get $100 a year. This is a flyer explaining that. And their Minute Clinic that they offer with no cost services. So I've given you a bunch of information about Aetna as well. And again, my name is Dan Toner. Please make sure you go in and make your elections, enroll or waive prior to the 19th. And you're welcome to call me with any questions or concerns that you need. I appreciate your time and have a great day.